I rise today to talk about the battle that is going on around the future of Australia's health system. We're currently involved in a debate about whether our health system is affordable, whether it's sustainable, whether in fact we can continue on the trajectory we're on in terms of government spending. Clearly, the Abbott Government have put forward a view that the increased expenditure on health has to be reined in. But what's, I think, worth reflecting on is the view that most people express when asked, what do people want from their governments? And what they say repeatedly is that they want a better health system, they want their taxes to support Medicare and the PBS, and to deliver a fair system of healthcare for those people who need it. It's worth reflecting on the health system at the moment and where the small increases in spending are occurring. The advances in science and medicine over the past decade have been remarkable, and we're now seeing modern medicine treat conditions that only a few years ago were thought incurable. We've seen remarkable progress on the issue of melanoma, for example, where we're now starting to understand that immune therapies are successful in addressing the issue of some cancers, and malignant melanoma in particular responds to medications that have their origin in the immune therapy. And there are a number of other conditions where we're seeing remarkable progress: the treatment of type 2 diabetes, ulcerative colitis, obstructive airways disease, and so on. So the small increase that we're seeing in health spending is, or comes about, as a result of these breakthroughs in health technologies and people getting access to new life-saving treatment. That's something we should celebrate. It's something we should be proud of. It's something that Australians want. And the real question is, should we spend government revenue on these measures? In order to answer that, we've got to address two pretty fundamental questions. The first thing is it a good thing to rein in spending in healthcare when the cost of that might mean denying people access to these life-saving treatments? Should we be decreasing spending rather than increasing it if the cost of that decrease is that people are denied access to medicines? And when you look at what we spend on health compared to other OECD countries, what you get is a picture of health expenditure in Australia that actually ranks quite low down when compared with similar nations. In fact, we are the 10th lowest of the 33 OECD countries when it comes to public spending on healthcare, the 10th lowest. And the question we should be asking ourselves is, in a rich, prosperous, developed country like Australia, why shouldn't we increase spending in healthcare? Why shouldn't we be increasing access to these treatments that we know will allow people to live longer and healthier lives? The second question is, if we are to increase health spending, is the level of spending we have at the moment, and any potential increase that derives from increased health technologies, is it sustainable? Can we continue to do it over the long term? And when you look at what Australia does spend on health and what it's spent over the past decade and what projections look like we will spend over the next decade, what you see is a picture of Australia's spending on health as a proportion of GDP being relatively stable, just over 9% now, increased by 1% or so over the previous decade and potentially increasing by another 0.5 to 1% over the next decade. If that spending is efficient, and when you consider that it is well less than that spent by France at 11.6%, Canada at 11.2%, the Netherlands 11.9%, and similar to the UK, and almost half that of the US, you begin to get a picture of a health system that is in fact not spiralling out of control, that is sustainable by world's standards. And yet we get the claim that the increase is spiralling out of control, that healthcare costs are rising in real terms, and of course that's true, but so too are incomes, so too is our economy growing. It's also estimated that average weekly earnings will double by 2050, making arguments using absolute numbers in healthcare almost meaningless. That's not to say that we shouldn't examine what are appropriate expenditures in healthcare and where we can get better efficiencies. No one is suggesting, even for a moment, that we shouldn't do that. But let's ensure that what we're doing is we're having a debate that is grounded in reality, that accepts the facts as they are. And in fact, when we took evidence through a recent Senate committee hearing, we heard from people like Jeff Richardson, who was the Professor and Foundation Director of the Centre for Health Economics at Monash University, who said very clearly that health spending is not unsustainable and that comparisons with other countries indicate that we do spend relatively little on health. We know that the evidence from the AMA was similar, that what we do have is a health system that is efficient, that does well in terms of providing equitable access to people, and that doesn't need the sort of radical surgery that is proposed by this government. You see, we have some big choices to make. The question of whether health spending is sustainable is not a value-free proposition. It is a choice that we need to make. It is sustainable if we choose it to be sustainable. It is sustainable if we choose to raise revenue to provide a treatment for people as new treatments emerge. It's sustainable if we begin to take on some of the inefficiencies that do exist within the health system, largely at the margins, but that are there and that allow us to get better value for money. That's the discussion and that is the debate that we as an Australian community should be having. And we shouldn't be disguising what is going on at the moment, which is a government that's trying to raise revenue and increase its tax base by raising the cost of healthcare in Australia, attacking the very system that we most want our governments to provide. The result of this is not just an attack on fairness, not just an attack on a health system that does provide people with the means to living longer and healthier lives, it's also very short-sighted in narrow economic terms. Most of the suggestions that have been put forward by this government will result in long-term economic costs. They will result in huge shifts from Commonwealth governments to state governments through the hospital system, and they'll mean that people are denied access to essential healthcare. We've got problems when it comes to collecting the data and evidence that are necessary for us to continue to build on what is already a very efficient health system, and getting a thorough understanding about what drives the cost of healthcare can only be achieved when we've got reliable data. And yet we've heard time and time again that the data sets necessary to be able to attack some of the inefficiencies in our health system are either not being collected, they're either unavailable, or at least not being made available to the people who need it. I mean, something as simple as getting an understanding of the linkages between the MBS and the PBS data sets is still unachievable. Health is too important to be whipping up a scare campaign. What we need is an honest and open debate about what we want from our governments. We need to ensure that we've got that debate happening in healthcare at the moment, and unfortunately That's not what's occurring.